Facilitators are GW Center for Integrative Medicine's Medical Director, Mikhail Misha Kogan, MD, and licensed acupuncturist, Angela Gabriel. And for those who may not be aware, they are our husband and wife duo. Take it away, Misha.
Okay, so let's see if I can share my screen, because if I'm not a host, oh, I can. Excellent.
Yeah, good.
Okay. So I decided to be a little formal today, and okay, that's slideshow from start. So lots of updates in the new year. So I thought that instead of giving kind of a more of a integrative approach, I'm just going to concentrate on vaccines, because I'm sure that's probably on what's everybody's mind. And then there's just one short update on the new strains. So without further ado, this is what we're going to cover. So the Moderna large study just came out in New England Journal of Medicine. This is the summary of their current up-to-date information. It's not a very long study. It's at about 54 days or 55 days now. That's the published data. So what you can see, and I'll show you a little bit in more details, but bottom line is there's pretty dramatic efficacy, and it's actually keep getting better, not worse. So usually when there's more data points, something that's not very efficacious after time will actually start losing efficacy. In contrast, here you continuously see that this separation between the events, the actual COVID disease in placebo, continuously increasing, while it's completely flat at the bottom in those patients who received vaccine, and the total number of participants in the study were over 30,000. So this is a pretty large trial. Now, we'll come back to the side effects, both systemic and local, but you can, of course, see that surely, as expected, there's a lot more local reactions on the site of injection and more systemic events. But interestingly, there's a lot of adverse effects in placebo group, which tells you that some of these effects are not necessarily from the injection itself, since it's just a saline, but from the placebo effect. Okay, why am I not moving? Okay, so this is the actual more specific summary. So you can see that the total number of cases as of November 30th was 196 cases, with 185 in placebo and 11 in vaccine. That's altogether. In case of severe cases, including deaths, there, by the way, notice there's very little death in the trial. So there was only one patient out of 30,000. You know, that's probably speaks to two things. So one is the fact that we're managing these cases a lot better, because 30 admitted, 30 severe means went to the hospital by definition. So very low mortality out of hospitalized patients, a lot lower than it was in the beginning. And there were basically none severe, no admissions to a hospital in the placebo arm. So, and interestingly is you can see that after one dose, there's still quite significant efficacy. The idea is that this efficacy is probably not significantly, significantly different, and that's why the 2 doses are recommended. Plus, it's not really clear as to how long that 1 dose is going to last. This 1 dose does come out to be important when we talk about side effects, and I'll come back to this. So, of course, this is on everybody's mind probably. So yes, there's been anaphylactic reactions as of today, or sorry, as of December, between December 14 and 23rd, there were a total of 21 reactions to Pfizer vaccine, significantly less to Moderna. And I know that this was one of your questions. And so there occurred at about 11 cases per million doses administered. Nobody died and nobody had any prolonged hospital stays. So this was anticipated. And so all the, by the way, if you haven't vaccine, you know that you're getting the vaccine in a healthcare settings, whether it's sort of healthcare setting being a pharmacy, or in case of other administrative, like inside a healthcare facility like a hospital. So there's some observation, and it will probably continue that way because exactly of this. So as we discussed, it's almost for sure linked to this PEG, polyethylene glycol, which is a complex sugar that's often prescribed as either for constipation or as a prep for colonoscopy. I have not, until this reaction started to occur, I have not heard of oral PEG causing severe allergic reactions, but we're probably missing them because I'm assuming that oral administration triggers much less reaction. Okay, so, and then the current CDC recommendations, this is where one dose comes in. So if anybody had a severe reaction to the first, they should not be getting second, whether it relates to a severe allergic reaction or non-allergic reaction. So non-allergic reaction, for example, could be a very high-grade fever, an exceeding, some kind of a exceeding pain syndrome, like severe headache, for example, and that's defined within 4 hours. The rest of it is all kind of left up to consultation with a physician. And, you know, there is no recommendation to say if you're allergic to another vaccine that you should be avoiding this one. And the reason for that is, well, none of us actually have had any vaccines like this two before. So, you know, the risk of cross allergy with another vaccine is very low. In fact, after doing back and forth multiple readings and thinking, I actually think that both Moderna and Pfizer are much, much safer vaccines than anything else we've ever seen. And the reason for that, I'll explain when we'll get to the AstraZeneca vaccine in a second. So right now. So the AstraZeneca is coming. It's a DNA vaccine, so it's an old type. We already talked about this. And the problem with all of this old technology is quite simple. First of all, it's still based on egg production, so that it's inoculated inside the egg. So anybody allergic to eggs should probably be careful not get this, since we have a choice. This is also the vaccine that's going to have preservatives, versus neither Pfizer or Moderna outside of PEG have any specific preservatives like thimerosal. That's all quite clear. And this vaccine is very cheap, much cheaper than both Moderna and Pfizer. And because of that, I don't expect there's going to be choice of getting single vial, non-preservative containing vaccines. It'll all be multi-vial doses, and they're all going to have preservatives. So you probably can sense where I'm going with all this, because you asked which vaccine you think is the best. So we'll come back to that in a couple of slides. So this is the AstraZeneca efficacy, a lot lower. So it's total of about 70%. You know, and after the first dose, it's only 50% efficacious. So it's not as effective, and it's probably going to be not as safe. So I'll move on to next. Unfortunately, the numbers for distributions are not great. The original distribution thinking was quite grand, but when life happened, you can see that numbers are not very good. And what's really kind of scary is that we're not really moving fast. So it's been less than 500,000 in all tri-state area that's been administered for a population that's much, much bigger than this. And of course, it was supposed to start, and it is, with just nursing homes as well as healthcare providers, but you know, we're still very behind what was planned. But these are the current dates, the current numbers. Now, I decided to mention this, and this is important because I actually didn't realize that herd immunity threshold for this specific vaccine is much, much lower. So this is taken, by the way, I forgot to acknowledge Dr. Siegel, Mark Siegel, I put it on the first slide, that some of the slides I borrowed from his presentation yesterday at Grand Rounds. So that's a good news. So we don't have to vaccinate a vast majority of people in order for us to literally stop the pandemic, assuming that the vaccine's efficacy going to stay where it is. Those of you who are very interested in this math, you'll have the slides later, but there is this actual formula how you calculate. Notice that the actual percent or actual threshold is very different for different viruses. So for example, for polio, it's much, much higher. For basically, for different influenza, it's also much higher. It's like 70 to 80%. That depends primarily on infectivity or how contagious the virus is. So, and you know, you can also see that the very big differences between different viruses. So like, for example, this influenza here, the threshold is way, way lower. So again, it's variable. So we are sitting right here in the kind of in the middle of the pack, so to speak. Okay, so let's go back to distribution because there's big news. At least in DC, the date of starting of general public has been announced, and it's next Monday. Are they going to adhere to this? I hope so. And you can see that this is the website. So what you need to do, I'm going to pause this presentation. I'm sorry. I have to how do I get out of here? I stopped sharing for a second because I got to, okay. So I want to go back to the websites. And so this is DC. So when you get to this website, coronavirus.dc.gov vaccine, scroll down, you're going to get to this place. You see where it says, if you do not work in healthcare settings, submit your email or mobile phone, and you will receive email or text message when the registry is open to additional populations. So you click on this, it takes you to this page where you can put either email or the phone number, okay? So I'll go back to the slides. I did not check whether exactly this, I did not check if exactly the same applies to DC and Maryland and Virginia, but it's very similar. So everybody's still in this phase 1A, vaccinating just healthcare worker or licensed providers, and then first line, so law enforcement, firefighters, and also nursing home residents and staff. So then 1B in everywhere is really people who are adults. Now notice the difference. In Maryland, it says 75 and older. In DC, it says 65 and older. And then other people like who are in assisted living or other congregate settings. And then the only C that's going to keep increasing the number of vaccinated, those who qualify. And then the Virginia is the same. Again, Virginia also 75. So now, how long will it take for the Virginia and Maryland to go from here to here? Hopefully days, and then from B to C. So hopefully it'll, there's been a lot of critique. Of course, you all heard about distribution process and the fact that probably distribution can or should occur a whole lot better than how it is now. So, well, I'm done really well with the slides. Wow, 15 minutes. I was thinking it'll take a lot longer. Okay, so I'll go back, I'll come to the strains and then the questions, some of the questions that you all sent already go next, and then we'll open up to regular questions. So new variants, there's mainly two. The first one was what's called the UK variant, but the actual number is B117. Now, these are numbers of a specific mutation. So you don't really, if you're really interested, you can go and look. But bottom line, they're carrying this very specific notification based on exactly what kind of mutations are prevalent in the given virus. And then there's the South African variant. Unfortunately, both appear to be more infectious, but not appear to be more deadly or carrying more severe disease. They both in a receptor binding domain, which probably explains why they adhere easier to the different membranes and cause infection. What's interesting is that currently, this is not, you're going to not find this in the news. This is an internal information. So currently, their expectations by FDA is that the current tests will not miss any of these viruses. So meaning that whether you have a new variant or the old variant, the tests are going to be pretty accurate. The accuracy is not going to be affected by the new variants. However, the tests for the new strains is currently being only in development, and we don't actually even know as to when the specialized tests for that's going to be on the market. Currently, they're just in the research. Okay, so the next is your questions. And these are the questions I got. I tried to answer them as much or as good as I can. So this great question about safety. Once you're vaccinated, am I safe to visit the family? So, you know, you saw the efficacy of the vaccines, Moderna and Pfizer, right? So chances are you're safe. Now, whether your loved ones are safe from you, that remains a really important question, because one of the biggest concerns with both of this vaccine is, let's say you got the vaccine on Monday, but you got infected on Sunday. The vaccine probably will protect you partially against that, but you may become completely asymptomatic and still spread, even though you've just been vaccinated. And then you may be spreading for several weeks and nobody will know. So bottom line, I would say you can probably be more comfortable and you can probably visit, but you probably should also still use protective equipment on both sides until both sides are vaccinated and until even a couple of weeks after that. Okay, make sense with that? Okay, so GW, currently all the healthcare facilities that want to become sites of distributions have applied in each state. Currently, GW does not administer vaccines or antibody treatment to general public outside of the regular care. So if you get admitted to a hospital and hospitals decides that you are going to qualify for it, they will give you antibody. Otherwise, you cannot just call and say, I would like to get an antibody treatment. That's not happening, that I can assure you. Unfortunately, the antibody treatment turns out to be quite not effective. That's what the data is. And the GWs actually, they still have supply, but they rarely use it. And only in the cases where they believe no other treatment should be applied. So it's not the mainstream treatment. I think unfortunately, this is one treatment that there was a lot of hope for it, but it just didn't really pan out to be as effective. The guidelines, so we covered that. Bottom line, if you have severe allergy to other vaccinations, it's not going to be contraindicated for you. However, if you had a severe reaction to the first one, you're not getting the second. So I hope that makes sense. Okay. Yes, I did get first. I'm due to get the second one on 19th. I will be getting second one. I had absolutely no reactions outside of a very slight pain on the site of injection. And Angela had vaccine 2 days ago, I think, right? And you had no pain at all, except for just a little soreness.
And we had different ones.
Right. So we're coming to that. You see the last question. So, yes, some of my patients got it, but not only the ones who are been in the settings of the either nursing home or home with nursing services. So yes, a few of my patients got that. Side effects, as I said, mostly it's a really pain on the site of injection. Interestingly, this is not the side effect I've ever seen before in myself. Like I had flu shots a few times in my life, and I don't remember having a sore arm after the flu shots, but this one was quite sore. For me, it was for about 3 days, but didn't interfere with anything I was doing. Okay, so the efficacy of Pfizer versus Moderna. The efficacy seems to be almost identical, maybe Pfizer slightly better. Moderna appears to be a little bit safer from total amount of side effects. However, here's what's interesting. If most of us will not have a choice. Basically, you're going to show up and you're going to get what you're going to get. And general public almost exclusively going to get Moderna in the early phases. Why? Well, because of the way we talked about this in the past, how those two vaccines stored. Moderna is stored at a much lower temperature, so that can be distributed through CVS, through facilities that don't have very specialized deep freezers that cost a lot of money. So that's basically, I'm not answering the question. I'm just saying what's realistically going to happen. Now, would I choose a Pfizer over Moderna for myself? I didn't have a choice, and I didn't want to think of that because I think the priority is here, get the first available when it's available. And the second big point that I want to make, if you really worry about allergies or autoimmunity, my suggestion, don't wait for DNA vaccines. My gut feeling is that these vaccines are actually going to be safer. Why? Is because our bodies have not seen this. They have not seen this type of vaccine. The PEG allergy is, in my opinion, is way lower than the reaction to eggs or thimerosal or any other preservatives. So my vote is simple here. Get first available of either one, whichever is possible. But as I said, most likely, most of you, maybe with the exception of a few people here, those of you who are healthcare workers, you're going to be in line for Moderna. Okay. And I think I have a couple more minutes for other questions, so I'm gonna get out of the sharing and the presentation so I can see your messages, because I'm sure there are some. Okay.
Yeah, there are a few questions in the chat, Misha.
Wouldn't newer, more contagious mutation rise the percent vaccine needed to achieve herd immunity? We don't know. But most, well, actually, no, we do know. Of course, the answer is yes. Yeah. We just don't know what that percent increase would be, right? So the original or the most recent understanding that I have is it's about 70% more infections. So yes, in short, there should be an increase in the needed herd immunity. However, we don't know how quickly that new form will spread. I mean, yes, it's more advanced, virus is more infectious, but is that going to translate in a speedy spread of the new forms? I'm not sure we can answer that easily. I'm pretty sure both strains already here. The key question is in what percent, and it also going to depend heavily on vaccinations. Now, the hope, and their answer is we don't know, but the hope is that the vaccine is going to be just as effective against the new strain as the old strains, but I guess that's also TBD as to whether that statement is accurate. I got a sore arm with a flu shot. Yeah, so the soreness with the arm is some people just have less of it than others. I don't know why I did not have it with the flu shot, but I have a gut feeling that they just were not giving it right. A lot of the times, flu shots were not administered by trained nurses, so they were just kind of stick it, wherever it went. But it's actually, the vaccines have to be administered in the muscle. It's a requirement because the way the immunogenic reaction has to be triggered, if you administer it into the fat under the skin, it's just not going to be as efficacious. And so the trial that you've seen, all those vaccines, all the people who administered the vaccines in the trial were trained how to give it right. So, you know, the hope is that if you feel soreness, then it's in the right place. So that's the minimum I can say about that. If you have tolerated all or PEG many times, yeah, that's a great question. I don't know, Rick. I'm not sure anybody knows whether or not that translates to 0 chances of an allergic reaction. That's the point. You know, surprisingly, for people who are very sensitive, I'm going to prescribe PEG so you can just get it from pharmacy and try it. And if you have a bad reaction, I say, well, then let's talk and decide whether it's worth it. So those of you who are really afraid, that may be one way to sort of test it. Now, that's not going to be a good test if you're going to be just fine. But if you have a reaction, that may pause a thought process of what to do. So, but again, there is no, I actually posed this exact question in the doctors group online that I sometimes in Facebook and everybody says, why would you do this? Because in reality, most people are, even those who are allergic, are not going to have any reaction because the oral administration from injection is very different. So, but my thinking as well, but at least if they do have a reaction, then maybe you should think about giving it. So okay, I read the vaccines cause memory problems. Yeah, this is first I hear. It's definitely not in the report, and no, this is not a reported side effect at all. I'm not sure. I know the disease definitely causes. Why would vaccine cause? I'm not sure. In your opinion, would surviving COVID provide better protection? Great question. So there's a lot of argument over that, right? The concern is that if you had a very mild infection, that your reaction may not be strong enough. So you may not be protected for very long with those antibodies that will be formed. But I don't think anybody can definitively answer that with the data we have. I mean, it's going to take a while for this data to materialize before this can be answered. So, you know, the problem with this question is not how to answer it, but in the question itself, right? I mean, if you got sick from it, you may be quite sick from it. And so the question should really be, what is the ratio of the risk of illness versus the benefit of getting it and not getting it again. And I don't think that question that's pretty simple question to answer, right? You don't want to get this disease if you can avoid it. So that's, I think, the way to deal with this. Did I miss anything? I think that's it, right? Well, we're right on time. So if any questions come up, just drop them in the box in the chat if we have a couple more minutes before the end. And I think I like this format, at least when I'm giving a talk, for people to send questions between the sessions so that it makes me think about them a little better and kind of organize their presentation. So if that works for everybody, send them ahead of time if you want. You don't have to. Last question, okay? So there still seems to be a lot of promotion of hand washing. Yeah, good question. My understanding is, well, hand disinfection, sure, especially those of us in healthcare settings, we can transmit it to others. But if you don't put that hand in your mouth or your eye, the risk is probably non-existent. And the same probably goes for disinfecting of surfaces. I think it's less critical than eye protection and face covering. I mean, yes, this is still emphasized in everywhere, but I think it's critical in the healthcare facility because it's actually a standard of practice for other infections too. But, I frankly we stopped disinfecting the food coming in. Like we used to wipe out packages and mail, and I stopped doing any of it because the more I read, the more I realized that even if you do pick it up from packager, the inoculum, the amount of virus you're going to get from those is so small that you're probably not going to get serious infection at all, at least in our household, where I think our personal risk is very, very low, relatively speaking. So, but, if you're very high risk, that may be worth doing at least some basic precautions. But again, great question. So thank you. And news reports today said President-elect Biden will release all vaccine, not hold any back for second inoculations. Not exactly sure what that means, but.
That is correct, Misha. That I saw that report as well in the Wall Street Journal that President Biden is planning to change the approach. President Trump's approach would be to maintain a stockpile to make sure everyone got that dose. But then there's all this research showing that maybe that first dose is okay.
Right.
And if we get more people with that, it might be better.
Right. So the priority is not to vaccinate everybody with 2 doses, but vaccinate as many people as possible, as fast as possible with the first dose, and then figure out when and how to get the second. Yeah, absolutely. Yeah, I completely agree with that. That just makes, well, I just showed you the slides, right? Remember, the first dose was about 80% efficacious. We don't know for how long, but that's a pretty good protection, if you ask me. And so the question is, should I forego my second shot so somebody else can get it? The problem, it's not just the availability, but the distribution. The problem, the vaccines are here. They're just, the distribution is not set up. So it's not the problem, and they keep making more vaccines. It's just the issues, how they're going to distribute them. So hopefully new administration is going to be smarter about it. Okay, I think I don't want us to keep going because let's shift.
We could talk about this forever.
Sure. Thanks, Janet. Perfect. Well, and it obviously gives me a special pleasure to introduce my partner and my wife and mother of our kids to lead today's practice, and I'll let Angela take it from here.
Okay. Can you hear me?
Yes, we can hear
me. Okay.
Yes.
Okay. Hi, everybody. Thank you so much for inviting me. It's my second time here with you. I was here a few weeks ago as an acupuncturist. I guess I'm still here as an acupuncturist, but I want to bring a little bit additional experience to my offering of the practice today. So I've been doing acupuncture and Chinese medicine for about 15 years, but I noticed that I tend to really like to treat people for stress and even beyond stress, trauma. So I got interested in body-centered, modalities of working with trauma, and one of them is Peter Levine's work, somatic experiencing. So I'm a somatic experiencing practitioner in training, actually pretty much at the end of the training. So I've been using this fascinating knowledge and practices and combining them with my body work. So like a lot of therapists use a body-centered approach, but also body workers use that that approach as well, which is really important to have both sides. So that's what I'm trying to bring in today. Obviously we have been experiencing a lot of stress lately for many months, and we still are kind of in the midst of lots of stress. And I also want to acknowledge that there are a lot of people that listening to me right now are probably way more experienced in a lot of what I'm telling you about. And also there have been so many beautiful practices led by other practitioners throughout this year. So you're all probably are very knowledgeable on this topic. So I'm not trying to say anything new, but still I want to give a little bit introduction, just a couple of words before I begin the practice itself. Just kind of like, just take you in with a few words. So, our reaction to stress can be very, different. It's not always that we just simply need to relax. I mean, that would be a little bit too simplistic. So what is balancing is like, and I thought like, okay, we need some centering and balancing practice, obviously. And what is balancing is not just relaxing, it's the ability to have a good window of tolerance where we can function well. So how many people here, for example, feel under stress, feel meaning agitated, feeling a little bit of that right now because I'm presenting to 50 people and my normal way of working with people is one-on-one. So I'm feeling a little bit of shortness of breath, maybe like more superficial breath. So I'm kind of a little bit there, but also how many people can feel the opposite under stress? They feel kind of going down under the water, like numb, a little fatigued, unmotivated. So let's say kind of even frozen. So that would be like being in a blue collar. And also how many people can feel a mixed condition, just going red, blue, and then out of blue, like red again. And that's pretty exhausting, right? And then there are people who kind of, feel balanced, maybe at times, maybe more, maybe less of the time, but there is definitely, we know what's the window of tolerance is when we're calm, but when we can be alert and present when we need, and then we can calm down again, and we can be relaxed at the same time as easily engaged, connected with self and others, neither too jittery or too flaccid. So this kind of being in a green zone. So the window of tolerance is being in the green zone, but there is no really kind of sharp demarcation of that window. It's just teaching our nervous system to be, dynamic and know how to self-regulate. So we could be mostly in that green zone, which means visiting red and blue as needed. So yeah, we can be in the and when I'm talking about nervous system, it's mostly like autonomic nervous system. So we can be in any corner of this landscape, and sometimes we need some relaxing practices, which would be like maybe slow breathing and stretching. And there could be times, and for some of us, or just sometimes, that we need to actually activate our nervous system in order to move out from depressed state or unmotivated state by doing a different type of breathing, like a fire breath, or maybe more cardiac exercise. So it's kind of like we need to be smart about like how we use these practices to regulate ourselves. But their practices, they're mostly balancing, and in general, they're harmonizing. They're gentle enough. They're not going to bring us too much over to red zone or to blue zone, while using at least those mechanisms. So that's what I will try to do today.
Angela,
yeah?
I think you should move the room because you're freezing very frequently. I turned off the Wi-Fi's that I could turn off, but it didn't really help.
The Wi-Fi.
Yeah, I think
I'm on old Wi-Fi. It should not be happening.
Right. So I don't know if you can.
Okay. How is it now?
Well, right now it's okay. So let's see.
So
if it happens again, I'll interrupt you. So just keep going.
Okay, I changed the Wi-Fi, so hopefully it'll be better now. Sorry about that. Mm-hmm. Yeah. So one such practice is the elemental breathing, as taught in some Sufi traditions. And I'm going to lead this practice, but I think Misha offered that practice once for you on one of the Fridays. But I'm going to add a little bit of a somatic attunement that comes from my work with as a somatic experiencing practitioner. So we're going to do that by combining breathing with sensing and stimulating vagus nerve, which is kind of the most important tree in the window of tolerance. So the good tone of vagus nerve, in particular the ventral function, for those who are familiar with this polyvagal theory, means that we feel more balanced, centered, connected, and coherent. So we're going to do five types of breathing related to the elements: earth, water, fire, air, and ether. And we're going to use our natural breath without any forcing. Just let breathing happen in a normal way. But also it's okay if it becomes slower a little bit, but naturally. So how's the sound? Okay now? Okay, good. So first, let's just orient ourselves. So first of all, I invite you to look around. Just let your eyes wander. Just look wherever your eyes want to look. Just kind of wandering, look, notice things around you. And notice something that makes you feel comfortable. It could be anything. A tree in a window, a familiar picture, a dog at your feet, just something that makes you feel comfortable. Okay. And then just come back to the center. And if you prefer, you can close your eyes. And just keep breathing. Sense the outline of your body. Just as you're here and now. And just kind of slow down and go deep. Raise your shoulders to the ears, like that, and tuck chin all the way into the chest, and cross arms like you're a tight rosebud. And stay like that for about 5 seconds. Just gently squeezing yourself, your arms and shoulders up to the ears. And then relax. Relax everything and let it open as a rose in a bloom. So that naturally slows our breathing. And then find your posture. straight but relaxed, sensing support of the chair. Your shoulders are at ease. Chin slightly down, Facial muscles are relaxed and jaw is relaxed. Top of the head connected to the skies and kind of gently floating. So, and we are going to begin breathing in and out through the nose for the earth element. And for sensing the earth element, form a loose fist with your right hand and place it in your left palm, like in a cradle. And let your fist rest and sense gravity, solidity, support, and safety. And now we're together doing 5 breaths in and out from the nose. And sensing again the heaviness of your fist, loose fist in the palm. And relaxing your hands. Now we're shifting to water element, breathing in through the nose and out through the mouth. So with both palms, form a cup, just like that, imagining the sensation of the fresh water, cool, pure water pouring into your hands from the spring. And we're doing 5 breaths, inhaling through the nose and exhaling through the mouth together. And just sense freshness and fluidity. And now maybe you want to wash your face with that water or just relax your hands. And we're shifting to the fire breath, breathing in through the mouth and exhaling through the nose. So for that breath, we're just going to hold our palms of the hands, just like we're trying to warm them up in front of the fire. Or it could be sunlight, just sensing the heat, our heart emotions, pure light. And just doing 5 breaths together. In through the mouth, out through the nose. And relax your arms. Moving to the air element, inhaling and exhaling through the mouth. And spread your arms like wings. It could be close to the body, could be a little wider, whatever is comfortable. Just like the wings. And sense the wind, space, openness, freedom. And we're going to do 5 air breaths together, in and out through the mouth. And gently fold your wings down. And lastly, the ether element. Breathing again in and out through your nose, gently. Very refined breath. And you can place your right palm on the heart if you wish, and left palm on your belly. Just sensing the integration of all these elements in one body. Sensing connectedness, centeredness, compassion, and balance. And doing 5 breaths of ether together. In and out through the nose gently. And just last breath as deep as you want in, and full exhalation out, just as a release. And you can just rub your hands together, wiggle, shift. You can open your eyes if they were closed, and just let your eyes wander again. Maybe find that side of that made you feel comfortable before, just saying hi. And that concludes the practice.
Thank you, Angela. We have a couple of minutes for people to reflect. I think that's pretty unique practice. I kind of wonder what people felt, and if anybody wants to share. Or
I want to say thank you, Angela. It really helped me a great deal. I really enjoyed it very much. It's been very beneficial. Thank you.
I'm glad. Thank you for feedback.
Hi, I've never done the fire breath before. I've done a lot of different breathing, but not the inhalation through the mouth and exhalation through the nose. So is that a practice you can do independently of the other breaths, or is it something you do in combination with the with all the elements?
So there are definitely different practices are called the fire breath. This is the fire mode of breathing within one particular practice. So there's also in Kundalini yoga and in other traditions, it's something it's called fire breath. It's quite different breath that's very activating. So with this one, I would say the best way probably to use it as a part of this balancing practice.
Okay.
If you feel like you want to do this one a little bit longer, maybe it's okay. But by no means, please don't, should not be confusion between something that's called the fire breath in yoga, which is very different. It's like very rapid, forceful exhalation. It's done like, so that's very different practice.
It's just that in terms of the elements, I think what I need most is fire. So,
so the practice came from a sushi teacher, and his commentary for this practice is that your body knows how to take what it needs.
of course. Okay.
So it's not really like we need to decide how much we're gonna give it of this, but our body will know the way how to balance.
All right, that makes sense. Thank you.
We can share, Lauren, we can share the description of the practice and put it on together with the slides from today's talk. We'll send it to Janet by the end of the day. I guess everybody is really calm. There's no. You don't have to stay till.
Hey, I didn't try to calm necessarily. I wanted to balance. So maybe if you were too calm, hopefully you're more alive.
No.
All right.
If anybody has any more questions, go ahead and unmute yourself. Okay, then.
I actually had a question.
Okay, Benita, go ahead.
So the question is that, well, I guess twofold. The question really is, the CDC has listed underlying conditions for Group 1C as their guideline.
Mm-hmm.
Somehow, and I sort of get the logic here, smoking, meaning smokers, are listed as Group 1C, but people with chronic illnesses that may not amount to immunocompromised is not listed. I find that very odd.
Yeah, I wish I have any idea how these categories came to be, or sort of, I mean, I'm sure, well, we actually have a regulatory agent among us. I don't know if she wants to unmute herself and say something. I guess she's taking her head saying no. Yeah, I don't exactly know how the sort of list of the conditions and the priorities were created. I mean, I think the first two categories are self-explanatory, but after that, it's just not as straightforward.
It's kind of weird because,
you know, I also feel strongly the other big problem here is, you know, you can have it's one thing on a paper, but your physician would know you a lot better, and so your personal risk may not be easily discernible from just a guideline, right? So that's also should at least theoretically be considered. And if the doctor says, look, this patient needs to be moved up in category, but I don't think that that's been created that way. So there are a lot of holes to all of this. And, you know, I don't know if this is because the current administration didn't put enough thinking to it, or simply because this is not easy to do, you know, sort of how do you, I also read a very interesting ethical concern, which I'll share. We have a couple of minutes. Is it okay? So I saw a concern by a Johns Hopkins physician, young gentleman. I think he's even younger than me, probably in late 30s or maybe early 40s. And he basically said the following: look, I'm going to not get this vaccine, not because I don't need it, but because my chance of dying from it, I'm young and healthy, is very, very low. So I rather give this vaccine to a nursing home resident or somebody else who's older, and I don't want to get it. You know, with that logic, you can think about this way. Okay, so if you have enough healthcare providers, simply quarantining them when they get sick, is that sufficient? And should we instead simply vaccinate first people at much higher risk for a really severe illness rather than just at high risk of getting it? The other issues, think of it this way. In the entire time the hospital was seeing COVID patients, I'm talking about our hospital, not a single provider got infected. And, you know, so what does that mean? Well, it means that our practice works. So why would we now vaccinate all of us who's seeing the patients if we historically demonstrated in the last whatever months that we haven't had any infections? You know, so it's a really difficult ethical conversation, and you know, it has considerations that sometimes are not in the mainstream media or in the mainstream discussion. So, you know, I wish I'd have more careful and more evidenced answer to give you outside of just my thought process here and the things I've read, but. You know, yeah, so Jennifer putting an interesting point. So shocked to see and notice that DC resident over 65 would get vaccinated before healthcare providers. I disagree with that. That's my personal opinion. I actually think that people over 65 should have been vaccinated at least at the same time, if not before. But again, the concern here is probably simple. If somehow healthcare providers starting to fall ill, no matter how ill they are, you have to quarantine them, meaning no workforce. And then who's taking care of everybody? It's a theoretical concern too. It hasn't really panned out, even though a lot of healthcare workers fell ill, but not necessarily because certain procedures were not followed or they got infected elsewhere. So, or they're simply in the places where you know, they were not aware of getting infected. That's actually probably where most of the healthcare worker got infected, because they were not practicing strict methods while not knowing that the patient that they're with is infected. In fact, I had 2 exposures. I mentioned that before. I had 2 exposures in the hospital that I was not aware of. They reported later saying, look, you got to call the OSHA or Office of Safety and Health and the report, because the patient you consulted on tested positive and got really sick. So I'm okay, but I was wearing all the correct, you know, protective gear. So, yeah. But it's a fascinating discussion, and we're right on time to end this today. See you guys all in the week. Stay safe. It's a little chilly outside, but it's supposed to be a nice weekend.